Hi, I'm Jason Rericha, and in today's financial planning and retirement update, we'll discuss Medicare and what retirees and those approaching retirement need to know to make the most of their financial plans. Healthcare is often the largest and most unpredictable expense in retirement, and Medicare is a central piece of that puzzle. Yet, despite its importance, Medicare rules can be surprisingly complex and catch even well-prepared retirees off guard. Over the next few minutes, we'll walk through some of these key decisions around Medicare, including how income affects your premiums and how to choose the right coverage for your situation. First, a quick overview of how Medicare is structured. Was signed into law in 1965 and today provides health care coverage for over 68 million Americans. The program has four main parts. Part A covers hospital stays and is typically premium free for most retirees. Part B covers doctor's visits and outpatient care and requires a monthly premium. Part C, known as Medicare Advantage, is an alternative offered by private insurers that often bundles in extra benefits like dental and vision. And Part D covers prescription drugs. A common misconception is that Medicare is essentially free since most people have paid into it through payroll taxes over the years. While Part A is indeed covered for most people, Part B premiums, supplemental coverage, and out-of-pocket costs can add up significantly. This is why integrating Medicare into a broader financial plan is so important. Next, one of the biggest surprises retirees face is something called IRMAA, which stands for Income-Related Monthly Adjustment Amount. Now, that's a mouthful, but in simple terms, it's an extra charge added to your Medicare Part B and Part D premiums if your income exceeds certain thresholds. What makes IRMAA particularly tricky is that it works as a cliff rather than as a gradual increase. If your income exceeds a threshold by even $1, you pay the full surcharge for that entire bracket. What makes this even more complex is the 2-year lookback rule. Your IRMAA surcharge is based on your income from 2 years prior. So the premiums you pay at age 65 are determined by your income at age 63. This means that financial decisions made years before Medicare enrollment, such as Roth conversions, capital gains realizations, or Social Security timing, can have real consequences on what you pay for Medicare coverage. There's much more complexity to Medicare and IRMAA, and it's easy to see why it's important to plan ahead. Finally, beyond income planning, one of the most consequential decisions retirees face is choosing between Medigap and Medicare Advantage. From a financial planning perspective, this really comes down to risk tolerance and the need for predictability. Medigap, also known as Medicare Supplement Insurance, works alongside original Medicare to cover costs like deductibles and copayments. Premiums are higher, but out-of-pocket costs are lower and more predictable. This can be especially valuable for retirees who prioritize budget certainty or who have ongoing healthcare needs. Medicare Advantage plans, on the other hand, often come with lower upfront premiums and may include extra benefits like dental and vision. However, they typically involve higher out-of-pocket costs, network restrictions, and referral requirements. In 2025, the average beneficiary had 42 Medicare Advantage plans to choose from, which underscores just how important it is to evaluate your options carefully. It's also worth keeping in mind that Medicare planning isn't a one-time decision. Plans, premiums, health status, and income levels can all change year to year, so an annual review is an important part of staying on track. We hope you found these insights on Medicare helpful. If you'd like to discuss how Medicare fits into your overall retirement and financial plan, please don't hesitate to reach out. We're happy to help in any way. And as always, healthy plan, wealthy life.